Budget 2024 provides an additional €2 billion for healthcare. It's an additional €808 million in core funding, €1,032 million in non-core funding, and additional €156 million in capital funding. The total health budget for 2024 is €22.5 billion. The €808 million core increase is a combination of €708 million to maintain existing services and €100 million for new developments. Funding to maintain existing services includes funding for inflation, rising patient demand, workforce measures, including the public-only contract, building momentum and pensions, as well as increases forecast for the state's claims agency. The €100 million in new development funding is to build on investments already in train. This includes staffing for 162 new hospital beds, 22 new critical care beds, 6 new surgical hubs, our first 6 surgical hubs other than Tala, and staffing for community beds, new community beds. It's funding for increased college training places and progress in advanced practice. It's funding for improved patient care via our patient access via our waiting list and emergency care initiatives. Progressing the new patient services is being looked at through various items, including the waiting list action plan as well. E-health, there's funding to progress better digital services for workers. We're expanding the free contraception scheme to 31 so that no woman ages out of the programme next year. And mental health, older person services, public health and social inclusion will be covered by Ministers Butler and Naughton. The €1 billion or €1,032 million in non-core funding includes continued COVID vaccines and testing and tracing, services to Ukrainians fleeing war, and our waiting list and urgent care plans. It includes building up the HSE cybersecurity and digital capabilities and addressing non-pay funding pressures in the hospitals for this year. We will be fully implementing the safe staffing framework. Over the past 3 years, this government has delivered record investment in healthcare. We've added 22,000 staff since 2020. This includes 6,700 extra nurses and midwives, 3,100 extra health and social care professionals, 2,500 extra doctors and dentists. We've added more than 1,000 new hospital beds. We've delivered a big increase in critical care beds. And this investment is having a positive effect. Last year, waiting lists fell for the first time since 2015. In fact, there are around 140,000 less people waiting over the Sláinte Care targets, the 10 and 12-week targets, than there were at the COVID peak. We've abolished inpatient hospital charges. Free contraception has been rolled out. 500,000 more people have access to free GP care. State-funded IVF has been introduced. The drug payment threshold has been reduced to €80. Hundreds of thousands of diagnostic scans that GPs refer their patients to are being paid for by the state. New services are becoming available for the first time in many different areas: women's healthcare, diabetes, stroke, genetics, dementia, obesity, to name but a few. We're also expanding our existing clinical services where there are strategies in place. This includes in cancer care, maternity, trauma care, home care, cardiology, ambulance services, mental health, and more. At the same time, like in many other countries, we are seeing an extraordinary increase in demand for services against a backdrop of very high inflation. As a result, the majority of this year's budgetary funding is focused on absorbing price inflation and meeting growing patient demand. There's a misconception that Ireland spends more on healthcare than other comparable countries. We don't. Of the 15 Western European countries, Ireland ranks 11th in terms of spending on healthcare per person, accounting for local prices. Germany, the Netherlands, Austria, Belgium, France, Sweden, Norway, Switzerland, Luxembourg, Denmark. They all spend more per capita on healthcare than we do, again adjusting for local prices. While we invest, we must also ensure that the investment is being used to the best possible benefit for patients. Most of the spending this year, above what is budgeted for, is due to higher prices and higher patient demand than was forecast and than was provided for in the budget. Turning patients away from hospitals is not an option. Nonetheless, there are opportunities to increase productivity. To that end, I've been working with the Chief Executive of the HSE and with my department for some time now on a structured approach to seizing these opportunities. This includes accelerating the implementation of the integrated financial management system and identifying opportunities in major spending areas such as agency, overtime and procurement. In fact, for quite a period of time now, we've been rolling out a productivity platform which will give us for the first time ever a clear central view of the amount of patient care that is being delivered in every hospital by every clinical team. And really, this is the first time we're going to be able to forensically examine and compare the productivity levels across our own health services and use that to engage with our healthcare providers, to recognise the people who are doing extremely well, learning from them and sharing their practice, and identify those who are doing less well and are less productive, and seeing what supports we need to put in place to bring that productivity up. As well as that, in the shorter term, obviously, we will improve cost controls, including on recruitment. To that effect, the HSE will shortly provide details of further hiring freezes being introduced in areas where the annual recruitment targets have now been met. In spite of record investment and important progress, we have a long way to go in terms of providing patients with the care they need when they need it. Waiting lists are still far too long. Emergency departments in too many hospitals are still under far too much pressure. I want to acknowledge the enormous difficulties this is causing for patients, and I want to state very clearly that improving speed of access for patients is the #1 priority for me, for my ministerial colleagues in health, for government, for my department and for the HSE. I want to finish Last Count Comhairle by acknowledging the extraordinary work being done by our healthcare professionals all over our country every day. We tend to focus here in the Oireachtas and in the media on what's not working for patients, and that's exactly what we should do. We do, however, spend very little time discussing and recognising the vital care that's being delivered every day to a very high level by our healthcare professionals. For example, our healthcare professionals have taken about 150,000 more patients off the waiting lists this year than was the target, and it was already, to begin with, a very ambitious target. Our waiting lists in the Republic are now half what they are in Northern Ireland. When we look at the number of patients waiting for a hospital procedure more than a year, the waiting list in the Republic is now 10 times lower than it is in Northern Ireland. This is thanks to the extraordinary work, the dedication, the efforts being made by healthcare workers all over the country. I want to acknowledge that, and I want to thank them for everything that they are doing and continue to do. We're very lucky in Ireland to have a health service that is staffed by highly skilled, dedicated professionals who we all know provide great care all over our country every day to our friends, to our family, to us, all in our time of need. And I want to assure them that we will continue to invest, we will continue to support them in the interests of patients everywhere. Gurmagad.